Assalamualaikum. In the previous lecture, we have discussed the what is anxiety and its definition according to DSM manual. Now, in this lecture, we will discuss the types of anxiety and what are the mechanism and the causes of the anxiety and what are the treatment approaches. So, according to if we talk about the types of anxiety, we have different types of anxiety according to the DSM-5 manual, and the first anxiety type is the phobias, and basically a phobia is a type of disorder which is a persistent and excessive fear of an object or a situation. So it results in a rapid onset of a fear, and it is obviously present more than 6 months. So first is the specific phobia. If we talk about the specific phobia, then we have the simple phobias. We have the agoraphobia, that is, or we have the fears of animals, social phobias, etc. um, if we talk about the agoraphobia, it is basically a phobia of the open area and the phobia of the people, and the opposite of the agoraphobia is the claustrophobia, which is an anxiety disorder that is due to the intense fear of the enclosed spaces. ठीक है. देन वी स्पेसिफिक टाइप ऑफ फोबियाज में हमारे पास एगोराफोबिया एंड क्लैस्ट्रोफोबिया हैं, एंड वी हैव सेवरल अदर टाइप्स ऑफ फोबिया एज वेल, जस्ट लाइक fear of animal, etc. Then we have a condition which is called as the selective mustim. It is a complex childhood anxiety disorder, and basically it is characterized by the child's inability to speak and to communicate effectively in the selective social interactive settings. For example, the child is unable to talk their teacher in a school, can't explain their problems. So these children are able to speak and communicate in those settings where they are comfortable, they feel secure and they feel relaxed. Then we have the separation anxiety disorder. Separation anxiety disorder, or SAD, is a disorder in which an individual observe or feel excessive anxiety due to the separation from their home, or for separation from a loving person to whom the individual has a strong emotional attachment, just like a parent or caregiver or a sibling, etc., or a close friend. So in separation anxiety disorder, whenever he is not in the same in emotional condition, then he will observe the anxiety. General anxiety disorder, we have already discussed that journal of anxiety disorder is basically the in this people basically suffering from the symptoms of the motor tension, autonomic hyperactivity for at least for a month. Then we have the unspecific anxiety disorder in which there is no reason for the anxiety. Then we have other types of anxiety disorder, like just like social phobias. And social phobias are those phobias in which the person is basically feeling anxiety in a social gatherings. Then we have the anxiety disorder due to other mental conditions, just we have discussed in previous lecture, that just like hyperthyroidism or any other mental condition, just like depression, psychosis, we have other types of the type of anxiety. Some substances are there which we will discuss later on, that induces the anxiety in a person. Just like we can say that these are the substances which basically responsible for the hyperactivity of a person. These substances are basically stimulant which activate the autonomic nervous system or excitatory pathways of the brain. Then, what are the causes or the normal mechanism? If we talk about the normal mechanism of the stress, then normal stress mechanism consists of various stages. And when a person is gone under a certain alarming condition, the body's stress response is activated. It's just like an alarm, a state of alarm. During this state, adrenaline and adrenal hormones like glucocorticoids, like cortisol, will be released, and these cortisol and adrenal glands hormones will stimulate the fight and flight response and lead to the activation of hypothalamus pituitary gland axis. This activation will lead to the symptoms of the autonomic hyperactivity like tachycardia, like sweating, like increased heart rate. By activation of this, the body begins to adapt certain strains of demands, the energy demands of the body increases, and then after that the body's normal mechanism to relax it will activate it, and the body will not keep is this continuous. So a resistance will be developed at the second stage. And why resistance is developed? Because the resources are now gradually depleted. Now not enough stress hormones are there, and the stress system is exhausted. So after the exertion, the body is returned to the normal function, and the heartbeat and autonomic nervous system will return to back. So, if we talk about the autonomic system hyperactivity, it will lead to the sweating, increased heart rate, and it if it is continued, and the body's defense mechanism or resistive mechanism is not activated, and the symptoms will continue, that it will lead to the gradual damage of the adrenal gland. If we talk about the anxiety, it's basically the imbalances of certain types of neurotransmitters like serotonin, like GABA, and like epinephrine. These three neurotransmitters basically play their role in an anxiety disorder. Then, abnormalities in the stress hormone like cortisol is also responsible for the induction of the anxiety symptoms. Then there is a theory or a model which is called as GABA model. According to this, GABA model postulated that decreased inhibitory receptor sensitivity with result in an excitatory effect, because if the body fail to resist, and the inhibitory pathway is not activated after the stimulation of the excitatory pathway, then this will lead to the continuous symptoms of the anxiety or anxiogenic state. Then here is a neuroanatomic model. According to this, a fair network in the brain which is involved the amygdala, hypothalamus, and brain centers basically affected in the anxiety disorder. So any problem in which there is a change in the neurochemistry of the brain, then it will lead to the anxiety disorder. Then we have the cortical atrophy, a disease in which there is a disease of the temporal lobe, which is lead to the anxiety disorder control, or to control the symptoms of the anxiety is lost in this condition, or this may be the this may be of genetic origin. whatever is the reason, it lead to the adrenal function impairment. And basically hypothalamus is there to maintain the homeostasis of the body. That is, it is responsible for the regulation of the blood pressure and body temperature, fluid body, weight of a person, and regulation of the sleep cycle, wakefulness cycle, and sexual activity. So all these are under the control of the hypothalamus, and hypothalamus is also responsible for the emotions regulation. So if the capacity of the adrenal gland declines, all these functions are affected. The the blood pressure will not regulated, it will increase. The body temperature will fluctuate. There may be edema, there may be increased weight or decreased weight. So the capacity of the adrenal gland is decline, and there are certain conditions which may produce after the anxiety. These diseases are ulcer, these diseases are depression or cardiovascular disorders. It means if anxiety is continue, then it will lead to the generation of the ulcer or depression state, depressive state, or cardiovascular problem, because autonomic system is activated, and heart is continuously in a tension, and brain is continuously in a tension, in a pressure, so it will damage the organ. As we have discussed earlier, that there are certain reasons in which there are certain conditions, if the conditions are there which are certain pathologies of other organs, they also lead to the lead to the anxiety. For example, in case of respiratory disorders, in any endocrine disorder, in any cardiovascular problem, and a metabolic and neurological problem, these pathological disorders will also lead to the anxiety. What are the drugs which are responsible for the induction of the anxiety? These are the basically stimulants, and they activate the autonomic nervous system. Sympathetic stimulant, they are basically sympathomimetics, act as an agonist at the sympathetic receptors, activate beta and alpha receptors both, and stimulate the fight and flight response continuously. The examples are amphetamines, cocaine, tricyclic antidepressant drugs, caffeine, ephedrine, epinephrine, pseudoephedrine, phenylpropanolamine. Then certain anticholinergics and antihistaminergics also responsible for the induction of the anxiety. How? Anticholinergics basically suppress the parasympathetic system, and if they suppress the parasympathetic system, then ultimately again stimulate the sympathetic nervous system. Antihistamine has certain side effects of the anticholinergic effect, so again they are stimulating the sympathetic nervous system. Example is the diphenhydramine, very common medication present in the cough syrups. Then we have certain dopaminergics, and the example is amantadine, bromocriptine, L-dopa, carbidopa, levodopa. Remember that basically dopamine dopamine neurotransmitter is basically involved in the brain reward pathway, and if the brain reward pathway, if the concentration of dopamine is continuously increasing at the synaptic cleft, then it will lead to the feeling of the euphoria. And again, if further it continue, then it will lead to the desensitization of the postsynaptic receptors. Postsynaptic receptors जब desensitized हो जाएंगे, तो again they lead to the symptom of the anxiety, because इसमें जो है अब डोपामीन की जो कंसनट्रेशन है, जो नॉर्मल कंसनट्रेशन, नॉर्मल जो फीलिंग है रिलैक्सेशन की, वो प्रोड्यूस नहीं होगी, और जो सेटाइसन सेंटर है बेसिकली, जो कि सेरोटोनिन पाथवे को के जरिए स्टिमुलेट होती है, वो सप्रेस हो जाएगी. तो सेरोटोनिन इज ऑल्सो इन्वॉल्व इन द रेगुलेशन ऑफ द symptoms of the anxiety, and it reduces the symptoms of the anxiety. Furthermore, the most interesting thing is that in case of certain drugs which suppresses the anxiety initially, but after their chronic use, if these drugs are withdrawn, then they again inducing the anxiety in a patient. For example, benzodiazepine is an anxiolytic drug. and this anxiolytic drug is initially used for the treatment of the anxiety. However, when the person want to stop the drug, then it is unable to stop immediately. Otherwise, the withdrawal symptoms, the patient will face the strong persistent anxiety. तो इसमें क्या होगा कि फिर पेशेंट के अंदर वो सिम्टम्स प्रोड्यूस होंगे. अदर एग्जांपल्स आर नारकोटिक्स, बार्बिटूरेट्स, सेडेटिव्स एंड अल्कोहल्स. Then there are certain other causes as well, which are the basically social causes, and among them the most important cause is the poverty. And people with anxiety or disorders often view themselves as a powerless, and they suppose that the world basically the people are treating them. So they may have the problem due to their family, and due to family issue there may be certain symptoms are there which are producing in a person due to family conflict, due to divorce of the parents, or due to the very strict parents, or due to disorder of the personality, or due to family dynamics. The person may suffer from the anxiety. One should differentiate the depression with anxiety, because there are certain symptoms which are similar between depression and the anxiety, and there are certain symptoms in which the symptoms are entirely different. Usually depression is associated with the continuous feeling of the sadness, irritability, and loss of interest in the normal activities. And in that scenario, the person want to isolate themselves and leave the social gathering. However, it is usually not associated with the autonomic surge, and there may be no feeling of the nervousness, there may be no high heart rate, there may be no sweating. Instead of that, the person is feeling low blood pressure, and feeling the tiredness, and unable to perform the muscular activity, feeling very weak, and very disturbed in the sleep and the appetite. Agitation is present in both conditions, and excessive worrying is present in both conditions, and restlessness is present in both conditions. So we will observe that there are certain drugs which are approved in for both cases, and there are certain drugs which are only responsible for the reduction of the specific symptoms of the anxiety. Just like that, we can say that benzodiazepine basically suppressing the autonomic surge of the anxiety, while 5-HT basically is responsible for the depressive anxiety state. To resolve the depressive anxiety state, we will use the 5-HT receptor agonist or partial agonist. What will be the treatment strategy of the anxiety? Briefly we will discuss the treatment strategy कि क्या treatment strategy है जिसके ज़रिए जो है वो हम करेंगे. The most important treatment strategy is the behavioral therapy, and in behavioral therapy the most important therapy is the combination of the psychotherapy with the pharmacotherapy with supportive approaches. Behavioral therapy is basically the aim of the behavioral therapy is to modify and gain control on the over the unwanted behavior, and it is followed by usually the cognitive therapy, which is termed as the cognitive behavioral therapy. So the aim of this therapy is to change the unproductive and harmful thoughts, to control the harmful thoughts, and the individual examine his feeling and learn how to separate the realistic फीलिंग फ्रॉम द अनरियलिस्टिक थाट्स, यानी जो एक चीज़ है जो कि रियल में हो सकती है और जो रियल में नहीं हो सकती, हाउ द पर्सन कैन डिफ्रेंशिएट इट. Then the individual is actively involved in his own recovery and has a sense of control. It is a lengthy procedure, and in this, the physician or the psychologist help the person to focus on the fear without trying to avoid or escape them. यानी पहली फीलिंग तो ये होती है कि escape or want to avoid the condition. However, the focus is now on that the person has to control its fear and to avoid the spaces and feeling more in control and less anxious. Then proper education is important and the monitoring is very important. Another approach is that certain relaxation techniques should be suggested कि किस तरह patient जो है वो relaxed condition में आए, and in two more method are there for the relaxation condition is that take a deep breath and go through for the exercise. So continuous exercising, especially aerobic exercises, is recommended, and at last then certain types of drugs or medication should be started so that the symptoms of the anxiety should be controlled. What are these drugs? Basically this is the revision of the relaxation techniques. These help to develop the ability to move to react more effectively, and it cope up the person with the stresses, and it also helpful for the reduction of the physical symptoms of the anxiety. And the main technique is the breathing, retraining, and the exercise. What are the pharmacotherapy of the anxiety? So first, for the suppression of the acute symptoms, we have the choices like benzodiazepines, and among them we are using basically diazepam, lorazepam, etc. We have certain antihistamines which have sedative effects to block by the blockade of the receptor, which are the histamine receptor in the brain, and basically they are helpful for the improvement of the thoughts. Then we have the 5-HT receptors agonists or partial agonists like buspirone, which is also a very good anxiolytic with minimum side effects. For the depressive point of view of the anxiety, some TCAs or antidepressant also prescribed with the main anxiolytic drugs to reduce the symptoms of the depression associated with the anxiety. These may be the selective serotonin reuptake inhibitors like citalopram, escitalopram, fluoxetine, etc. So these are the choices of the drug. Then we will individually discuss anxiolytics in the next lecture. Thank you.